Thank you. So tonight is really just discussing what exactly is a period, the differences that we may see across different individuals, and really understanding that if your flow is heavy, you don't have to go with the flow. There's different things that we can try to help minimize um, basically having a poor quality of life and ensuring that you don't have a burden of care or burden of your chronic condition every day of your life. So next slide. Really, I wanted to just talk about having knowledge is power. So understanding what's happening to your body and understanding the changes that will occur in preparation for your first period, or even if you've gotten your first period, and what really can affect your period. So what can make them better, what makes them worse, and understanding if you have a bleeding disorder, what are the implications of that. How to be prepared when you're going to have a period, and then when to seek medical attention. So what's not normal and what you should be calling for help for. Next slide. So in order to understand periods, we need to understand puberty in general. So there are certain transformations that occur as a child into adulthood that are going to occur prior to your period starting. So we call these secondary sexual characteristics. So basically you go through changes in your body to ensure that you're at the reproductive capability. So to have a period, you're having a period in order to then have children per se. So basically, what happens is you'll have the onset of pubertal changes, which we'll go through. And usually these are dictated by genetic factors. So if your mom had her period at 13, there are certain genetic factors that you have 50% of your mom. You will know that those implications will then probably dictate that you're going to be closer to when she had her period as well. That being said, there's certain caveats to that, and the fact that you have 50% of your biological father as well. So you don't, the implications of what is in his family. Additionally, if your mom doesn't have a bleeding disorder and you have a bleeding disorder, that's going to change as well. Not necessarily the onset of your period, but how your period may look like. Your geographic location, so where you live in the world, plays an impact, your nutritional status, and psychological factors, so stressors on your body, which will also impact when your puberty is initiated. So for example, menarche is what we call the first period, or when you're going to start your period. In populations where, like, we live in Canada or United States, so we call those developed countries, the average age for a period is about 12 and a half years of age. When you look at a spot like Haiti, so in Southern America, South America, we know that Haiti, um, usually they're not as developed, they're not as nourished, so we see a later onset of periods, so of the average age of 15 years. So that just shows you that geographic location does have an impact on when we see periods starting. Next slide. And this is just to highlight that everyone's journey is different. So some girls may start wearing deodorant because they have body odor at 9 years of age. They may grow really fast at 9 years of age, where her counterpart, who is 9, may have no signs at all of any pubertal changes. You may see someone that before you're going to high school, you don't see a girlfriend for a few months. And then within the few months of then next seeing her starting school, she may have grown a whole head. Or you may have another girl in your class that started wearing a bra when she was in grade 4 versus someone wearing it in grade 9 because they had no breastfeeding until then. So just knowing that everyone is different, puberty onset is different for the whole population. And really, there are certain signs that we look for, which I'm going to discuss, that will tell you or be an indicator that your period is coming soon. Next slide. So this is kind of a caricature, basically showing you that there's certain stages in which you're going to go through prior to getting your period. So there's a range between 8 and 12 years of age that some girls will show no signs and other girls will start at 8. And then there's another range, 8 to 14, where you start to see a real increase in weight and then a spike in growth. So all of a sudden they gain weight and then they shoot up and they get very tall. And that's their growth spurt prior to their period going to start. And then they start to see maybe they have some breast budding. maybe some fine pubic hairs that are starting to show under the arms and in the pubic area. And then as you get into the 9 to 15 age range, as you can see, the range is very wide still. You may see people still growing, breasts becoming fuller, and gradually we start to see some vaginal discharge. And then some may start at this point getting their period. And then we keep progressing. So 10 to 15, where you see underarm hair, and then breasts getting bigger, and then pubic hair getting more coarse. And then again, it's saying some girls start their period now. So as you can see, not all of the physical changes have to happen for a period to start, but you do need to see progression with these changes in order for a period to begin, because these changes are hormonal changes that are happening that are then going to prepare yourself to have a period. Next slide. So when you go to clinic, when we talk about periods, people may talk about Tanner staging. So Tanner staging is 1 to 5, and basically it's saying to us, if I say to my physician colleague, she has a Tanner stage of 3, then they'll know exactly what I mean by that. So I don't have to say she has a little bit of pubic hair, more than breast budding, starting to get fuller. So instead of having to have that full description, we all know based on the Tanner staging here on the right side of your screen, where that patient will be. And basically knowing at a Tanner stage of 3, at that point, periods may start. So 3, 4, and 5. By 5, you're considered an adult. So just so you're aware, the first physical sign of puberty is usually breast budding, and then followed by pubic hair and axillary hair, underarm hair. And then we know that usually after that starts to occur, not necessarily is it going to be an adult form, but if you have a little bit, then at that point you may see then your growth in weight and height, and then the next stage will then be the onset of your period. Next slide. So what exactly is a period? So every girl, well, I guess I shouldn't say every girl, majority of the population are born with 2 ovaries and contain thousands of eggs. But these eggs are only immature at the time of when we're born as a baby. And then as you start to reach puberty and as hormones start to change, they mature, and hormones tell these ovaries to start releasing ova. Next slide. So this is just showing you basically the anatomy picture on the right side of your screen. So next. So you see your fallopian tubes, which hold your ovaries in place. Next slide. And then your uterus below, which is basically where your egg is going to drop into. And then below your uterus is your cervix. Next. And then your vagina. So your egg would pass through from the fallopian tubes into the uterus, down cervix, out of your vagina, and that would be your period. Next slide. So once a month or so, we would say you would get your period. As Dr. Pike had mentioned, periods are very variable, especially when it's your first period or first, I would say, year of periods are all over the map. So for our population, our patients, I say bleeding disorder aside, we call these periods anovulatory. So it's very difficult to dictate when a period will occur after you've had your first period. Some girls will have it again in like say 35 days. Some may have it not for 3 months. So it really is dependent on how your hormones are adjusting. So once you have your period or you menstruate, one egg is leaving the ovary and it's called ovulation, and it travels down the fallopian tubes to the uterus. The whole purpose of this is that it's going to the uterus to see whether it's going to be fertilized. So once it gets to the uterus, the uterine lining is thickening to make a nice nest for potentially a baby. If the male sperm meets it and fertilizes it, the baby then implants into the uterus, and at that point, then they start growing a baby. That being said, if there is no sperm and it's not fertilized, the egg keeps passing down the uterus into the cervix, like I showed you, out the vagina, and that's what's called your first period. And typically a period should last 4 to 7 days. Next slide. So this is just to give you kind of a picture of it and a schematic kind of idea of what days you kind of expect what part of the cycle. So about 2 weeks after having your period, another egg is released from the fallopian tube, from the ovary into the fallopian tubes, and the cycle starts again. So this menstrual cycle takes about 28 days. It can be longer and can be shorter. So as you can see on the bottom of the screen, stage 1 is your period. So on day 1 of your cycle, we say that is when your period starts. depending on how long your period is. Let's just say for this presentation, day 1 through 5 is your period. Then your second stage would be day 5 to 13 is pre-ovulatory, so before an egg is released. Stage 3 is ovulation, where your egg is released, goes down the fallopian tubes. And then basically stage 4 is if you do not fertilize the egg. Post-ovulatory stage is that's when you release your lining of your uterus, and then that's when you're going to restart again at your period. Next slide. This is a different schematic kind of way of looking at it, because a lot of hormonal therapies that are used in bleeding disorders patients, they come in packets of 28 days or circles of 28 days. And this is basically what it's kind of schematically telling you. So you get your period, that's when you do your sugar pills or don't take any pills. And then all of a sudden you're starting your pack. And it's basically imitating what a period cycle would look like in a patient. Next slide. So as I mentioned, you do not start ovulating right away. So when you release an egg, when you first start your period, it's not the point where your body is ready to actually be fertilized and have a baby. So a lot of it's anovulatory, meaning that you're releasing, but the hormones aren't ready to actually have normal cyclical process of having a regular period every month or every 28 days. So we call these anovulatory periods, and they're very irregular and they're very painful. So a lot of young girls that come to us saying my periods are so heavy and so painful. The pain is usually associated with being an anovulatory period, and that does get better with time. The irregularity or the flow of the period doesn't necessarily get better, and it really depends on concomitantly with your bleeding disorder, is that going to have more of an impact? Next slide. And this is just another kind of graphic presentation. I think some people have a better idea when you start to show them kind of through a picture what's happening. And every row of this graphic is really showing us what's happening in our body. So the first is basically the actual egg itself and releasing of the egg. The second is showing actually your body temperature changes with your period in the cycle and where you are in your cycle. Where hormones are released from your brain or hormones that are released from your ovaries. And then it shows you how your uterus, actually the lining thickens and thins depending on where you are within your period. Next slide. So this is really, I found a really interesting article that talked about, in general, in a pediatric journal, why we should be asking about menstruation in young girls and adolescents. And really, it's like another vital sign. We take your height, we take your weight, your blood pressure, your heart rate, and asking about periods is really going to give us an understanding of potentially why is that blood pressure low, or why is that heart rate up, or maybe why did you have an increase of height or increase of weight? Have you had your first period? Next slide. And I think it's really important. When I found this quote, I thought it was great, because why do we care? We should all care. And this quote really highlights why we should all care. I'm working and teaching toward the day when all clinicians care about an event that happens monthly for half of their patients. So 50% of your patients are girls. Why aren't we asking this? The menstrual cycle matters for women's health and well-being. Let's all afford it the attention and importance it deserves as we work toward improving the health of all young women. Next slide. I found this very interesting and actually kind of upsetting when you think about it. So menstrual history taking annual well visits for adolescent girls. So this study actually looked at adolescent medicine clinicians, family medicine, so your family doctor, and then pediatricians. And it looked at, in a chart, those that actually completed a menstrual history. So over 954 charts were looked at. Only 443 were actually asked about their period. So adolescent medicine did great. They did 97% of their patients, they asked about their period. Family medicine only asked 5% of their actual patients that were women, and pediatrics asked 9%. Which to me is astonishing, in the fact that as a pediatric treater, we have patients that we see on a regular basis. And for me to see a girl and not ask her, one, if she started her period, or ask anything about her secondary sexual characteristics, whether she has any, or when I examine her, whether she has any, or even just to talk about anticipatory guidance as to what to expect, it kind of is mind blowing, to be honest. Next slide. And really, why I think this, even if I wasn't a bleeding disorders nurse practitioner, is up to 1% of women and girls have a bleeding disorder, and many don't know it. So if we're not asking the questions or we're not asking the appropriate questions, how are these girls ever going to be diagnosed and ensure that then they have appropriate quality of life? Next slide. So what can affect or change your period? Next. So hormone levels, as I mentioned, so especially in the first year of life, first year of your period, you're going to have anovulatory stages. So you're going to have hormones that are not necessarily at their normal levels that they will be when you reach more of a ovulatory period. Stress, if you're worried, increased physical activity to the point where it's extensive, and maybe your body fat is really low. Um, you're having more weight loss. And then if you have a bleeding disorder on top of that. Next slide. So red flags, your period that's not normal. So what are we looking for? Next slide. So if your period's lasting more than 7 days, if your bleeding is heavy enough to soak through a pad or a tampon in 1 to 2 hours, if you find that your attendance to school or participation in activities is impacted because you're worried about overflowing or leaking, or that you're going to have to change your pad or tampon too much, that you don't want people to notice that you're constantly going to the bathroom, um, or you're having to double up or triple up because you're worried that you may leak. Altering your social schedule and events. So if you think your period's coming, you don't plan anything, or if you're on hormone therapy, you try to change your packs around to try to manipulate when you're going to get your period because you're worried that something may happen. So as I mentioned, flooding, unexpected onset of flow. So it's like turning on a faucet. All of a sudden, it just gushes. Or you're having clots that are greater than a size of a quarter. And periods are usually associated with iron deficiency. So if you've been told that you have iron deficiency, but someone can't tell you why. Next slide. And heavy menstrual bleeding is the most common symptom reported in women with underlying bleeding disorders. And when heavy periods run in the family, it even more so then, it is a red flag for us clinicians. And the reason for that is one of the most common bleeding disorders, von Willebrand disease, is autosomal dominant. So we know that if a parent has it, she has a heavy period but doesn't know, 50% chance her daughter has it, has a heavy period, doesn't know it. And it kind of just goes down the family because everyone just thinks that that's normal for them. Next slide. And as many as 1 in 10 women that have heavy periods will be diagnosed with some type of bleeding disorder. However, that being said, there are other causes that can cause heavy periods. It may be thyroid problems or uterine fibroids, other reproductive problems, or certain medications or blood thinners that patients may need to be on. Next slide. So just to recap, is your bleeding normal? So these are the indicators this is not normal. So heavy periods that last longer than 7 days, you change your pad or tampon more than every hour, you are iron deficient and possibly anemic, or you pass large blood clots. How long should your period be? Periods that last up to 7 days is normal, but the average is 3 to 5 days. If your periods last longer than 7 days, take a self-test or seek medical attention. Next slide. So what is iron deficiency? So iron deficiency is not normal. I know that a lot of women are iron deficient and they think that is normal to be iron deficient as a woman. It is not normal at all. It's a condition where basically your blood lacks red blood cells, and red blood cells transport oxygen around your body and particularly to your brain to function. So patients with heavy periods that are iron deficient typically are less productive. They miss work, they miss school, they're irritable, and they also have other symptoms, physical symptoms. So poor concentration, headache, heart palpitations, shortness of breath, chest pain, pale skin, dizziness, as you can see the list there. And one of the interesting things that a lot of young girls will say to me, I just love chewing ice. Ice is one of the most common symptoms of someone being iron deficient, just chewing ice. And what we call that is pica. And basically having unusual cravings can tell us that someone may be iron deficient. Next slide. So what is our actual clinical definition of heavy periods? So more than 80 mils of blood loss per period. So how do you know 80 mils? So if you're changing your pad more than every hour because it's saturated, if you're soaking through pajamas or bed sheets at night, and being iron deficient typically leads to anemia. And then having periods that are consistently longer than 7 days in duration. Next slide. So comparing a normal period to an abnormal period. So then we quantify it. So we think of what is the actual amount. A normal period is usually about 30 mils in a whole cycle. 4 to 6 days. Normal tampons hold 5 mils. So if you soak 1 to 7 normal sized tampons for a whole period, that's normal. But then think of if you were to use a super or a very large maxi pad or a pad, those typically are 10 mils. So that would count as 2 of the other products. So if you're doing a super size, then that means you have to multiply that. So for example, if you were to go through 5 super tampons, that would be 50. So that would make you very close to abnormal bleeding. So just so you're aware that depending on if it's a regular or whatever it may be that you're using, there is differences in the amount of blood that's absorbed. For abnormal bleeding, we say it's greater than 80 mils per period. So 16 soak pads or tampons per cycle, and usually you're iron deficient. Next slide. So I thought this was really funny, and the fact that even still when I go to Walmart or Shoppers Drug Mart or wherever it may be buying pads or tampons, it is still so confusing as to what I'm buying. And then now that I've given you all this extra information, and on top of that, trying to figure out, am I on a super, am I on a normal, am I on a liner, am I on a 2 or a 3? Like basically what you need to know is that if you're saturating every 2 hours, if you're having overnight leaking, your periods are probably not normal, and just seek medical attention. Next slide. So what should you do proactively for heavy periods? So if you've already started your period and they're heavy, you can use an app. So as Dr. Pike just mentioned, now you can use We Thrive if you want to, or there's Flow, or there's Period Tracker. This helps you kind of understand at least the duration of your period, not necessarily give you a number like a PBAC score, which I'll show you that Dr. Pike said, but this will at least give you an idea for duration of your period and kind of highlight the symptoms that you're having. Have lots of fluids. So when we lose blood, we're losing volume, blood volume. So if you increase your fluids by water, that's helping to keep your volume up, your blood volume. Take iron supplements proactively, increase your iron in your food. So red meats, legumes, that will help you with trying to keep your iron up proactively. And if you're feeling dizzy or your heart is racing or pounding, get up very slowly. So a lot of girls that have heavy periods will have orthostatic hypotension. So basically what that is if you get up really quickly from laying down to a standing position, your heart doesn't have enough time to compensate and your blood pressure drops really quickly. So that will make you feel dizzy and feel faint. So just remember to get up very slowly and stage yourself from bed to sitting on bed to then standing. Next slide. How do you know if your periods are heavy? So how do you quantify it? So this is, next slide. This is what Dr. Pike was talking about previously, which is the PBAC. But before we talk about the PBAC is Let's Talk Period. It was an app that was actually developed by Dr. Paula James in Kingston that actually goes through periods and tells people whether it's normal or not normal, and when to seek medical attention. So this is something, even if you have a bleeding disorder, I think it'd be really interesting to do to see if it would tell you to seek medical attention based on your period. Next slide. And it goes through different questions. It actually talks you through all symptoms of bleeding to see if it's not just uterine bleeding, because that helps with delineate whether you have a bleeding disorder or not a bleeding disorder solely based on your symptoms. Next slide. And just so I wanted to highlight here is that those that have bleeding disorders on the call is really knowing that if you are diagnosed with a bleeding disorder, regardless of what type of bleeding disorder it is, whether it's a carrier of hemophilia, von Willebrand disease, a rare factor deficiency, platelet disorder, all of these diagnoses have the symptom of heavy periods. So they're all in common with one another. So it doesn't matter what bleeding disorder you have, you will all experience heavy periods to an extent if that's what your biology is made up to be. Next slide. And this is the PVAC score that I wanted to talk about. So this is the number that Dr. Pike was mentioning that will show up on your app by telling them how many tampons you have that look like that, how many pads you have that look like that on each day of your period. So if you were to come to clinic, we don't have an app, but we basically will ask you, can you tell us on day one, if you're using, are you using pads? Are you using tampons? Or are you using a combination of both? How many of your pads or tampons or both are being used on day one, and what do they look like? And then we're able to calculate out a score. So if we can calculate out a score and it's greater than 100, we know that you lose at least 80 mils of blood for every cycle of your period. And this will then tell us that you have menorrhagia or heavy periods. And from that, we then will try to intervene with different types of medical interventions. Next slide. So as I mentioned, von Willebrand disease is one of the bleeding disorders. It is the most common bleeding disorder that we will see. Women are diagnosed more than men because of their heavy periods, and it can be very serious. Next slide. It affects about 40,000 people in Canada, and roughly 1% of the affected are registered. So that just shows you that a lot of people have the disease, but do not know they have it. Next slide. So it's VW is the most common bleeding disorder in the United States, but also in Canada, affecting 1% of the population. It affects both genders, so males and females equally, because it's autosomal dominant, meaning that if one parent has it, 50% chance that their child will have it, whether boy or girl. And then platelet disorders are the second most common bleeding disorder among women. Next slide. Next slide. So why are bleeding disorders such as von Willebrand so underdiagnosed? It depends on the disease severity. It depends on the age of the patient. So a lot of our patients won't get diagnosed until they actually start their periods if they don't have any other bleeding symptoms or haven't had any surgeries that made them bleed. Family history. So if there's no family history, if they're a new diagnosis with no mutation in their parents, or if there's parents that have bleeding symptoms, but they thought it was normal, so then they thought their child had normal symptoms, or there's basically the symptoms are not always obvious. So it just, as I mentioned, may be normal in the family, or they just may be easy bruising and they think their child is just a rambunctious child that just bruises. So I think it just really depends on the history and who they actually bring attention to their child with regards to their symptoms if they have concerns. Some patients will just go to a family doctor and say, oh, my child has nosebleeds. And they'll say, oh, well, they're at an age where they pick their nose and kind of dismiss. And then they don't follow up later if the symptoms persist. So I think it just really is, it's a challenging diagnosis to make, especially when you don't know how to navigate the system of where you're supposed to be asking those questions or pursuing and advocating for yourself. Next slide. So having this knowledge now and your period has yet to come. So I think what's really important is have the discussion with your healthcare provider about a plan. So have a proactive plan so you feel in control, that you're not nervous about when it's going to happen. So understand the exchanges that are occurring in your body and know the signals that when your period may start. So if you have breastbudding, usually 2 years after breastbudding is pretty much classic of when your period is going to start. Meet with gynecology to discuss potential hormonal options, increase your awareness so then you don't have to make an on-the-spot decision when all of a sudden your period starts and it may be heavy. It may not be, but it's a good thing to know if it is so you don't feel uncomfortable. Network within the community like you're doing tonight and hear other people's experiences. Have tranexamic acid at home. Have a discussion of when to call for help. So review the red flags that we talked about, just to have an idea of when you should call for help if you feel that's necessary. Next slide. And really understanding the management for symptomatic heavy periods in girls with underlying bleeding disorders. So typically we start with tranexamic acid, and then we may do a combination of hormone therapy, so birth control. And then from there, we may talk about an IUD insertion if those aren't working, or if that's the preference over hormonal therapy, so oral birth control. And then the last case scenario is Depo-Provera that we can do just to shut down periods altogether. And typically IUDs will do that as well. Next slide. So that was kind of a general overview of periods and kind of what are our red flags that we should look for and when to seek medical attention. And I hope that was helpful, and I'm happy to answer any questions at this time.